Hey everyone, welcome back to another NDBI Navigator vodcast episode. I am incredibly excited to have Dr. Katherine Pickard on us, joining us from the Marcus Autism Center down in Georgia.
Thanks
Katherine,
so much for having me, Jamie.
yes, I've been wanting to get you on for a while, so I'm excited that the stars aligned for us to connect to get you on.
Yes, very excited to be here. So,
Love it. Well, I always ask everybody that comes on the same kind of kickoff question, like, tell us about you, what you're doing, what you guys are doing at the Marcus Center for the people who are listening who might not even know about the Marcus Autism Center. Give us a spiel.
I love that. I can definitely do that. Yes. So I am at the Marcus Autism Center, which is in Atlanta. And it is one of the largest, if not the largest, autism center in the US. And we're affiliated with Emory University. And so my position is that I'm an assistant professor on faculty at the Marcus Autism Center, but my main appointment is through Emory University and their Department of Pediatrics. And so I have been at Marcus for about almost 5 years now, which is hard to believe. I moved from Colorado in 2020, right, when all of the pandemic was unfolding, and I'm really grateful that I landed there. So um, I would say over the past 5 years, I've essentially been working on building out community-based services for kids with autism and their families. And so thinking about the fact that most families, right, don't access specialty autism centers, nor should they, to access high quality care. And so the team that I lead at Marcus focuses on how do we effectively partner with our community systems and build the capacity of our providers and our systems to deliver high quality care. And so the name of the team that I work on is the Access Lab, and that stands for Advancing Community Care, Equity, and Sustainability of Services. So pretty much all of the work that we do is in the community. We have ongoing partnerships with Georgia's Part C system, their early intervention system, also with the Department of Education, and then with various kind of ABA organizations. So we're super fortunate in that most of the work that we do actually does not occur inside the walls of Marcus. Again, we're really thinking about how do we help families access care in their own communities where they live.
I love that. And was that the reason that you guys moved to Georgia was for the position?
Yes. Yes. Yeah. I don't think I imagined that I would end up in Atlanta. But
Good
Atlanta is
smile.
an awesome city. And we moved, yes, so I could take a position at Marcus.
I love that. Yes, hot Atlanta. I'm excited. We were
Yes.
talking just before we came on about the WEDA
Yes.
conference, which is always a great conference to go to. So anyone who was looking for something to do in hot Atlanta in July, check out WEDA.
I know. Get to experience the thick of the heat. Yeah.
Yes, that's great. I love that. And I love that you guys are really such a community outreach. I didn't realize you guys were one of the largest. So
Hmm.
what type of therapy would families come in to get speech, OT, PT, like the whole
You
diagnostic?
got it.
Okay.
Yeah, there are a number of clinical programs. We have a large diagnostic program, and so that is a good chunk of the services that are provided. We also have a really expansive feeding program, that is providing supports for kiddos who also have co-occurring feeding challenges. We have a complex behavior team that supports kids and teens who have any number of behaviors that is it's getting in the way of them being able to participate in the community. And then we have a relatively large early intervention program and ABA program. The early intervention program uses an NDBI called Project Impact. And so that program serves kids predominantly under the age of 4. And we use Project Impact, which is a parent coaching model. And then our ABA program also is very focused on delivering NDBI services to autistic kids and their families. So those are probably the main programs in our department.
And so you guys would have kiddos, you mentioned a teen, so you've got the early intervention
Yeah.
program from 0 to 4, and then kind of going through lifespan, you have programs for older kiddo? Sorry, older for me, 7 and
We
8.
do. I mean, I think we could always use more, right? Our Marcus has historically been focused very much so on early identification and early intervention. So I would say the vast majority of programs are really kind of focused on young kids. We do offer some services for teens, and do have like small mental health kind of programming for teens, but we could use much more. I think that's an area of growth probably for us and for a lot of places.
Yeah, and how cool to infuse NDBI with the
Yeah.
kiddos and kind of keep carrying that over from the Project Impact stuff that you guys
Yes.
do to your ABA influenced NDBI for that age range, and then that next level up of kiddos that are needing some social skills support or mental health small groups, like you had
Yeah.
mentioned, using the same really cool core values that we get in NDBIs and just kind of pulling it through and then
Totally.
putting some research out there so I can say NDBIs are good for anyone, right? Because
Totally.
just to see.
Totally. Yes. 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 And it's really great to be at a place where, we have many different disciplines that are kind of coming together to deliver services. So it's nice to see that kind of integration into treatment as well.
Yes, I was going to ask you about the integration of care. So for the kiddos in the ABA program, you
Mhm.
guys would be working together with if they were getting SLP services or OT or maybe specialty feeding, it would be this wonderful integrated village that everyone would be kind of supporting that child with on the same page.
Yes. Yeah, I think that's the goal, right? I think the integration of services is super important. In our ABA program specifically, they've been working really hard to integrate speech language services. And so, there is some co kind of intervention that occurs between our BCBAs, RBTs, and speech language pathologists. There could be much more, right? In our early intervention program that uses Project Impact, we have psychologists and speech language pathologists. We also have care coordinators who are able to kind of come in and support families in accessing various services. And so we are working on that, right? We strive for that, and I think could also continue to grow in that area, right? There should be more interdisciplinary care.
Yes, I love that. I
Yeah,
feel like that's such a big focus in NDBI.
totally.
Kind of in my old days of
Yes.
traditional ABA alone, protective, we know everything, right? I didn't feel like I really got a lot of opportunities to have
Yeah.
that integrated care model, and it was really not even that valued that much. So
Yeah.
really switching over to NDBIs has just opened that back up for myself to say, I
Totally.
feel so much more comfortable over here. I am not the speech expert. I am not,
Exactly.
right? Let me go to the
Exactly.
person who can help me
Exactly.
help that. Yeah, so.
I feel similarly, right? Like I am not a speech language pathologist, right? I value deeply the integration of AAC for our kids who need communication supports, but I myself can't
Yeah.
actually, I don't have the expertise to do that, right? And so I think being able to have that support is huge, and to be able for, our families to have that support be actually integrated, and happening at the same time, I think can be really powerful. Um,
Yeah.
there's a lot, I think, it's not always the easiest to do, but I think it's really important.
Yeah, and I feel piggybacking on that, families that get it at the same time,
Yeah,
but also from the same place. So they're not
exactly.
driving all over. Atlanta's a big metro, like
Totally.
all
Oh my
over
God.
different
Yeah. Sitting in
providers.
traffic. Yeah. Yeah.
Different funding, different LOA. Do you know what I mean? Like just from a parent perspective of trying to juggle and manage all of that. And if you have a one provider who doesn't want to play nice with another provider and you get
Totally.
conflicting messages. So being able to be that one-stop shop kind of hub for them, speaking as a parent myself, like in any realm, I would think that would just really reduce a big stress load of, okay, here's where we're going
Yeah.
to get support. I'm not spread thin
Right.
physically, but also mentally, like, oh, it's,
Totally.
no.
Totally. And trying to coordinate everything. Yeah. Yes. Yeah. I think it can be really nice for the families who can't access it. And I think, um, I think a lot about that too, who does get to access those services, right? And how and I most of the spend a lot of time thinking about the families who aren't accessing those services for any number of reasons, right? Because no different than any center, right? We have long wait lists. To your point, we are in Metro Atlanta, right? That's not always accessible to families. And it still takes a lot to get in the door, right? And so, I think it is totally our responsibility to be thinking about how do we make it so that families don't have to access these services at Marcus, right? So that they can get them in various other settings, right? Whether that be in Part C or in their schools or in other kind of outpatient settings. Now, right, that's tricky, but I think it's super important. It's really nice to be in a center where I can see high quality, like I see that integration and the consistent delivery of good quality care, and get to also think about, well, how the heck do we do that in other places, right? Because that's super important.
Yeah, and kind of figuring like replicating it or scaling it out
Yeah,
or looking at what are the kinds of kiddos who need this level of support.
totally,
How do we get them out so that next kiddo who needs that level of
totally.
support comes in, and then the little one that's now at a lower level of support or back in the community, how
Mhm.
are we still continuing to support them in that, make those services accessible in that setting, and just like this never-ending revolving door.
Totally.
Kids get off a wait list and get into services, and they're there for a long period of time. And if they need,
Yes.
that's what they need. But
Yes.
have this provider capacity issue where there's not enough supply to meet the demand, and
Totally.
that wait list just backlogs and backlogs and
Yes.
backlogs. So I love
Yes.
the thought of kind of being able to support them in different environments, which I think would shift things around from a provider perspective of freeing up some time to keep moving the kiddos through these different pathways of service
Exactly.
delivery. Thank
Exactly.
you.
Yeah.
Yeah.
Yeah. It's so important to be thinking about how do we do this more efficiently and in a way that ensures that, yeah, kids aren't in intensive services for long periods of time, right? And,
Mhm.
making sure that there aren't those backlogs.
Yeah, and that community practice aspect. So
Mhm.
you mentioned Part C. You guys are going to do some support with kiddos in Part C. Can you talk about that a little bit more?
Yeah, I can. So we are super fortunate. So we've had a contract with our Part C system, which is called Babies Can't Wait in Georgia for a number of years. And that contract comes through our Department of Public Health. And so our job is to work with the system and to build the capacity of early intervention providers in Georgia to deliver high quality services to kids who are in the system who either have been identified as having autism or who, right, maybe have screened positive on an MChat or on another screening tool, but who are not yet accessing autism specific services or who have not yet been diagnosed. And so that's a good number of kids in Georgia. Our system serves about like somewhere in the ballpark of about 19,000 kids every year. And about 20, I mean, from what we know, about 2,500 of those kids do screen as having a high likelihood to be autistic. And so it's, we think about really just kind of building up kind of provider capacity to serve these kids. And we train specifically in Project Impact. We do a number of different things in our contract, but one of the main things that we do is we train in Project Impact. And we don't just train in Project Impact because we know that, one-off training is great, but anyone who has been a provider knows that like it's just not that easy, right, to put programs into practice. And within systems that are underfunded, there's often a lot of workforce turnover and other issues playing out. And so we are also, in addition to training, thinking about first, how do we make our NDVI programs more flexible and adaptable and easier to use in Part C? And then in addition to that, how can, what is it that we can do at the system level to
Mhm.
help many more people be trained and supported in doing NDVI? So we're not just doing training, we're really trying to kind of address some of these big picture issues that make it less likely that providers are doing NDVI.
Yeah, and I feel like that systems kind of change really kind of gets back into that scalability. Like if we can
Mhm.
invest and kind of help these systems, and it kind of just morphs into the new system or the new status quo is that caregiver coaching involves NDBIs. And
Totally.
and we
Totally.
built that model and we've shaped that model. But I
Totally.
appreciate your provider capacity comment
Yeah.
about training people one time, like that one off. There's so much
I,
more to support
yeah,
caregivers. And
it's,
I don't know about you, I didn't have training in my program for how to train caregivers or support
oh,
parents. It's those interpersonal skills. And when I moved into NDBI world, hello, here's what you do, right? So
yeah.
thinking about that training aspect, do you guys have a process that you guys go through in terms of supporting your providers or the Part C providers that you guys are coaching and supporting? Kind of part of the research study, you have a whole thing that you're going through.
Yeah, we do. I can tell you how it's evolved. We um historically have trained using kind of a combination of like self-paced modules and then live. We obviously started this pilot in 2020, live virtual training. And so there's kind of an asynchronous component, a synchronous component, and then there's optional group consultation that we do where we're supporting providers and learning and using Project Impact with families that are on their early intervention caseload. And that has been extremely rewarding and I think has been really kind of helpful for our team. I know I mentioned like one of our goals is to make NDBI or maybe Project Impact specifically, right, more flexible and adaptable to the system and the providers who are using it. And I think for any provider, right, you might be trained in an intervention, right, like Project Impact, but ultimately, right, the families that you're working with have many, right, many priorities and many needs that may or may not be within the scope of Project Impact. And this is one of the challenges, right, in our field is that we have some really amazing programs, but that are manualized, right? And so our team has been really collecting a lot of data on how do providers deliver and adapt NDBIs and how can we take that information and use it to ultimately ensure that programs are a good fit for the system and that providers feel confident delivering these programs in a way that fits for families that they're serving. And so that's been a really fun project is, we do our kind of standard training and that looks probably very similar to a lot of NDBI trainings. But alongside that, we're really trying to collect data that then supports how we're training, right? And really thinking about training people in more flexible delivery models.
Yeah, and you have that manualized kind of model, but you're also able to individualize it, kind of flex the
Exactly.
system in a way that best supports the parents, the kids, the caregivers, but doesn't detract too far from the manualized model. So you're getting the best of both worlds. And I think it'd be really interesting, and I'm sure that you guys are tracking that. What are those pain points or those barriers? Like
Mhm.
the train, like people don't feel
Yeah,
confident training parents because they never had
totally,
it. They feel uncomfortable. They don't think
totally.
parents value it. I'm sure there are all of the things like why is it hard for some people to do caregiver coaching?
Yeah,
Maybe that's never
absolutely.
been on their radar. And as a part of
Yeah,
moving into like a BCBA role, just drop my pen, is that
totally.
you now have to coach parents for
Yeah,
97156, whatever the code is.
exactly.
You don't even,
Exactly.
yeah. Okay. So having that data and that information of how do we support those providers to help support parents.
It's
Um,
so important. Yeah. And most to your point, I feel like irrespective of your kind of disciplinary background, many providers, don't get support in coaching parents and effectively partnering with parents. And so that is part of what we're doing, right? There's certainly the content of NDBI, like what are the strategies you're teaching parents, but there's also the process of delivering it. And I think that both of those are really important things to be training on.
yeah. So I think they heavily influence one another that you
Yeah,
couldn't separate them apart.
yeah,
That's
yeah. So it's a really fun project. We're again really fortunate to be partnering with the system and I think, being able to learn from the providers that we're fortunate enough to work with. So we're excited and I think to your point earlier, thinking about well, how do we build a model that is also sustainable and scalable in the system, right? Like, how do we, um, right? Like, get the system in a place where like our team doesn't need to train, right? Or maybe we provide some support, but we're really just kind of there for support.
Yeah.
And so thinking about like, gosh, how do you do like train the trainer? And do people have the time, right? Like, are we asking people to train, if they don't have like the dedicated time to do it? So trying to figure out some of those issues.
Wow. Okay. Well, let us know when you have those answers because I think
Yeah,
a lot of us are very
seriously.
interested to hear what that magic
Yeah,
secret sauce is that you guys
yeah,
find. I know myself personally.
yeah.
That's incredible. How did
Yeah.
you get started in NDBIs? Did you kind of come from that background, morph over into something different, come back, or what's your journey been like?
Yeah, that's a great question. So, and I saw that when you sent me those questions, and I was reflecting on it. And so I have, been involved in kind of the autism world for a while. And actually, before going, like, while I was in high school and undergrad, and I ultimately was very interested in going to grad school and was interested in autism and in early intervention. Um, I don't think like, when I was applying to grad school, like I don't like NDBI wasn't really like like as formulated as it is now. And so I didn't like choose to go to grad school for autism like NDBI. I went to grad school because I was interested in autism early intervention and was super fortunate to end up at Michigan State University. And so my grad school advisor was Brooke Ingersoll, and she developed Project Impact. And so that's how I was introduced to NDBI and especially parent coaching. And I'm deeply grateful that that is just the lens that I like came into NDBI in, right? Was just in a parent coaching world, right? don't know any different. And so, as I kind of was trained up in NDBI and got more and more experience coaching parents, it's a love, right? I love partnering with families. I think there's something extremely powerful in being able to form really strong relationships with families and empower them in ways that are meaningful, right? And to help them feel more connected with their kids. So I think, I don't know that I don't know that I entered the world like intentionally, but feel very fortunate that the stars kind of aligned and I ended up in a space where that's just what we did, right? So yeah, it's been a fun journey to be on.
But- So you're deep into Project Impact. That's incredible. I
Yeah.
didn't realize
Although I will say after I was at Michigan State, I did my internship and a 2-year postdoc at University of Colorado where they have a ESDM program there. And so I kind of flip-flopped for a little bit into ESDM land and then kind of back to Project Impact in part because when I moved to Georgia, our early intervention program at Marcus had just started, and the psychologist who had started it picked Project Impact, and actually at the same time, our Part C system asked to pilot Project Impact. And so we were just like, this
no
is a great
brainer.
fit. So, I think like certainly have exposure to other NDBI programs. And I think some of the decisions around like, using different ones has really been driven by just the context that we're in and
Yeah.
the honestly, sometimes just like the state.
Yeah, yeah, who's available and
Yeah,
what's being researched and what's available for providers out there. And yeah, I
right.
just love that overarching NDBI because there's so many things that I pull from all of them that I love.
Totally.
Yeah, I
Yeah.
love STM land, but I love Connie stuff with Jasper. I love the
Yeah.
stuff with impact
Yes.
and certain things that overlap and then certain
Yes.
things that no, it's really only talked about here, and I love
Yeah.
it. So let me give you this resource to use. I think that's really helpful to have. And I know that speaking to my skills, kind of thinking about supporting parents, wow, do I really feel like I'm a much better behavior shaper, shaping the repertoires of somebody who didn't have a program like an RBT who
Totally.
came to a treat, right? It's a whole nother
Totally.
level of skill repertoire shaping. And I feel like
Totally.
I can take any technician because I can support parents who kind of come in without that theoretical background and understanding. They just have a love for their child and a high interest to help support them. And those are two really incredible things to have in for a behavior change maker, right? Let's do
Yes.
it. Shape this because you're
Yes.
in it to win it. Um,
Yes, I think you have a much deeper appreciation of adult learning and how to effectively kind of support people and learning and using strategies that may or may not, like be familiar and that may or may not even fit their family, right? And so I think like really, being able to understand and connect with families and help them in a meaningful way is super super important. And to your point, I think it's been an extremely powerful and ongoing, learning experience. I still love doing it.
I love what you said about being meaningful. And I think back to, X amount of decades ago, things I was telling parents or asking them to do now as a parent myself. No, they don't have
Yeah,
time to do that.
totally.
Best intention, theoretical, conceptually systematic. Here's your
Totally.
program to help support your child. And I just think now I have one kid, one, and I'm like, no, I don't have time to
Yeah.
do that. And it
Much deeper appreciation. Yeah, I'm sure.
so, and really kind of resonating with parents, what can you do? And NDBI is really pushing in. This is again pre-NDBI, where we were asking parents to set aside time, right?
Oh, I
Now
know.
coming into, let's lean into the routines, and let's lean into what you're doing and start scaffolding and
Yes.
support the learning, which is a very different, I think,
Yes.
parents' time,
Yeah, I
right?
totally agree.
Yeah. So I think that just again makes it meaningful for the family, higher likelihood they might implement the supports or strategies that we are coaching them on and supporting them with. And it just makes a well-rounded, better equation. It doesn't mean that they wouldn't have the most intent to help support their child in a different kind of a context, but life happens. And they
Totally.
get
Totally.
busy. And then I feel like
Totally.
feel bad. Well, I didn't have time to do it. And then yikes,
I know.
that's right.
Yeah, I think there's a lot of it's been fun to kind of see how, NDVIs have evolved and to think about, I think what you're alluding to is really important, right? Which is just how are they framed, right? And how are they, like, what is the messaging that's sent to parents around their purpose and their intent and how they're supposed to be used, right? And, thinking about how to make these programs fit for families. And I think a lot, right, about the fact that most NDBIs were developed with white, highly educated families, right? And so, I think there's been a shift, right, to really kind of question, right? Like, how are we partnering with families? Are these strategies aligned with families from various sociocultural backgrounds who were not included in treatment development? So I think
Under
there's a lot to unpack, and I think the what I appreciate about our NDBI programs is by and large, right? They are designed to be flexible, and I think from a research standpoint, we really can unpack like, are these programs like a good fit for many families, right? And why or why not? And to really be intentional about how we're delivering and adapting them. And I think that's a really important piece. When I think about workforce development, I think about, if we're going to be moving these programs into communities serving, you know, minoritized and
the
low
resource.
income families who experience a lot of psychosocial stressors, right? Like, what are we telling providers, right? And how are we coaching them to deliver these programs in a way that is culturally responsive and flexible to the needs of families? And I think that's a really like, I think we all as clinicians do these things, right? Like when we are working with a family and we are making all sorts of decisions, right? Like to drop things or maybe add some things or maybe talk about something else. And I think, it's our job as we move forward in the NDBI world to be thinking about how do we make some of those clinical decisions more explicit. So that way when we're training providers, we're training them to deliver these programs in a culturally responsive way. And I think that that's really important and like super hard, but super important.
I know cultural fit and diversity, again, kind of thinking about pairing up providers and having a context or a reference or just a basic understanding of the
Yeah,
home environment you might be walking into and how to separate that from maybe your own personal upbringing
right.
that will be very different perhaps. And how are we working on those cultural sensitivities or supporting the family
Hmm.
under resourced areas and goodness of fit and
Yeah.
You have to have that
Absolutely.
relationship and that rapport with your parent coach. And if, personalities clash and we come in with different values or preconceived notions
Totally.
how they should be parenting, then that probably isn't going to bode well for an ongoing collaborative parent caregiver coaching relationship.
Totally.
So I love that you guys are thinking about that because
Trying
that is
to.
an important topic. And I'm thinking back to the conference. I don't know, maybe 60 different countries people were there from, shocked that
Wow.
NDVIs are that reach. But I
That's
also remember,
amazing.
no, right? And I was talking with Yavana,
Uh,
their NDBI book, and she had shared that book has been published more times outside of the US than in the US. So
that
to,
is so cool.
yeah, it just makes me scratch my head of how do we get this out there in the US by this,
Totally.
right?
Totally.
I was like, huh, I didn't realize NDBIs had such overarching kind of reach in the world. And so I am so excited to get to talk to people like yourself and other professionals who are out there doing this incredible research and then
Hmm.
trying to get those people, hey, how do we align project impact for families in Thailand? Because there was a professor that came in from Thailand for the conference and just really building those connections, the Connections Conference, and
Totally.
trying to get people to kind of work together in that capacity, which is exciting. Sometimes I think it's hard to find people if they're not in your orbit
Totally.
or track their email down or reach out. So I think it's great that you guys are actively looking at that just within the scope of things. Like Atlanta is very diverse, right? You have a lot of different
Mm-hmm.
things going on. It looks a lot different than the small little village that I live in, Iowa, right? It's not very,
I believe that.
that is really interesting to see.
I
Do you
believe that.
advice for practitioners, students, behavior analysts, anyone listening who wants to learn more about NDBIs, come work with you guys at the center? Any advice you would share with them about if they wanted to incorporate NDBI into their practice, what would be helpful to think about?
Hmm.
Lessons learned.
Mm, lessons learned. Such a good
Mm,
question.
mm,
Ooh, I I mean, I think there's like two, again, I think I alluded to this before. There's like two components maybe of NDVI. There's like what are the actual strategies, right, that are considered to be NDBI strategies. And I think that's one thing. And I think those are super important to learn, right? But I think that the thing that I think a lot about is process, which is like how do you deliver those strategies with families? How do you deliver those strategies in a way that is neurodiversity affirming, right? Culturally responsive, right? How are you, so I think a lot about process. And I am not sure that I have specific strategies in terms of like, you should go read this book or like listen to this specific, go to
uh-huh.
these modules. But I think there's real value in if you have the time, right? Showing up in spaces where you get to learn from other professionals, where you get to learn from families,
Yeah.
and ideally where you get to learn from autistic people about kind of their preferences. And so to me, there is real value in like continuing to do the amazing work that you're doing, right? Working directly with kids and families, but at the same time, really exposing yourself to kind of the perspectives and values of lots of different people. Because I think that, we that to me, I think has helped to shape my delivery of NDBI more than anything. It's just kind of the continued learning that I
Mhm.
get to do from other disciplines, right? I think about my speech language pathologist friends and BCBA friends. I think about the family organizations that I've been able to get involved in, and also the autistic providers and family members that I work with. And I think they have informed my delivery and helped me think about process in a way that I might not have gotten from just like reading a book. So I do think there's like some of it is, certainly, you know, continuing to work with families, and then also some is just exposure, and trying to learn from other people.
Different perspectives, different voices, and
Yeah.
kind of having that influence you. And I find it interesting. A lot of the NDBI articles that I read, they don't really come out of our behavior analytic, right? lingo.
Mhm.
So
Yes,
I worry sometimes that people are just really looking at Java and some of our articles, our journals that we typically publish in, that they're missing out on this big world out there of
totally.
different researchers and professionals and perspectives that are also pumping out some really great NDPI type research. So
Yes.
that's always something I think about, like expand your, if you do enjoy reading journal articles, not
Mhm.
everybody does. I love it. Expand your base, your search
Yeah,
of like where you are looking at those articles and find value in that they are
totally.
peer reviewed, right? Journals, and that they do hold a lot of really great information for us to
They
be
do.
able to.
They do. I think, yeah, I think trying to get that exposure and easier said
Yeah.
than done, but like really trying to get it and then the other thing is I think like when you're learning in DBI, I do think it's really important to have like a buddy, like a group of people that you're learning it with. I think there's real value in that. Right, like it's hard to learn things on your own. It just is. And so I think to the best extent that you can to have someone, even like it doesn't have to be a mentor, right? It could be a peer, it could be your coworker who's learning it with you. In our, early intervention program at Marcus, like we still to this day have like every other week group supervision, right? Where we get together and we do case presentation. I know that's not uncommon, right? But I know it's also hard to find the time, especially when people are very busy and have high caseloads. But I think that there's real value in that. I think from an accountability standpoint, right? Making sure that we're delivering high quality care, and then also to work out all of the things, right?
Yeah.
um, so I think if you can find a friend, I think that's a good idea.
The friend. I love that. And you also have that built-in, like you said, support system or the buddy to reach out. Like we don't all have the answers. And sometimes that different perspective and that viewpoint can just be pivotal. And okay,
Yes.
that helped me
Yeah.
fix something or adjust something, or you're struggling with that too. What can we do to adjust this? Like it's a
Right.
pain point that comes up, a hiccup in the system or the process across more than one person, then that's data that could help us influence of we should probably change that or make it a pivot and do something a little bit differently. And there's just kind of numbers, having those support in numbers is just, I think, a really great idea. And I agree with you. I can see a lot of incredible value for having a cohort or gosh, even finding people on a Facebook group, just reaching out
Totally.
and finding your people, and then
Yes.
being able to create those relationships with those people to kind of influence your practice and
Yes.
influence theirs and have this really great
Yes.
learning, this bi-directional learning opportunity that you have.
Yes. Yeah,
Yeah.
I agree. I think it's super, really, really important.
Yeah. Any recommendations for how you stay up to date on the cool stuff that's happening out in NDBI world?
Oh, so good. Well, I'm definitely guilty to living in a more like research oriented bubble. So
Get your
I think I
journal
could probably use,
notification.
yeah. So I read a lot of research, which I is not like a very accessible thing, but I um, read a lot of research. And in addition to that, I try and go to conferences. I stay connected with a lot of coworkers and colleagues who are doing NDBI. And I think that, yeah, to me, I think conferences and trainings are the best way for kind of ongoing exposure. Like most disciplines need CEs, and so I do try and really think through like what are some CEs that are like actually relevant. Um, and a lot of those CEs are in DBI land. So yeah, easier said than done, but I think a
Right?
combination of reading, conferencing, workshopping.
Google, I'm on Google finding. I'm curious
Yes,
if you've ever been to, so I typically hang out in like autism or behavior analysis conferences, but I have seen like early childhood education, like INSAR. I'm looking at different types of conferences that I typically wouldn't go to because I don't know that I would get credits for.
yeah,
I'm very much interested would I find NDBI panels, papers, presenters there, because that would be, again, a wonderful way to kind of expand the bubble of support and learning from peers. Have you been to any of those types of, I guess I live in maybe,
I think like if you, I think, I mean, yeah, the notion, I think the concept, the CE's piece is like what's so tricky. And like, I mean, two conferences can be really expensive. I know, I'm like, oh gosh, why are they so expensive? But I have ASHA is a great conference. Our speech, yeah, a lot of amazing speech language pathologists who attend that conference and a lot of talks that kind of sit in that NDBI land.
Very good.
There's also
What about Asha?
will
Yeah.
come up this year. There's the it's like the conference for research innovation and early intervention. It's like an early intervention conference. But I think, right, like the question is like, do you want exposure to research or do you want like exposure to like clinical practices, right? Do you want like a workshop, right? And so I think really trying to figure out, because like some conferences are very research heavy and there aren't as many like clinical training opportunities.
Yeah.
Um, and so I think like trying to kind of weed some of that out. But I agree. I think there's real value, again, if you have the opportunity to do it, to attend either conferences or workshops
Yeah.
outside of your field.
I think that could be a really good, I might create something and put it on the NDBI for ABAI SIG, just kind of a document like where you might find, like where in the
Mhm.
world is that, but you might find it at ASHA and it might look like this or by these presenters. Maybe I can delegate it to one of somebody's students. You might find it at the Early Childhood Education Conference and they might
Right.
call it this, right? So it might not say NDBI, but the tenets or the characteristics, like you might get something of really good value from looking at these types of presentations or even journals or
Mhm.
yeah, I feel like sometimes we have this great overlap, but they might call it something a little bit different. And it still is kind of in the peripheral of that's meaningful. And I would find value in learning more about that, especially as I'm supporting parents or caregivers or young
Mhm.
children, right? It's a whole nother kind of know your audience. And so for me, I tend to go to the conferences about more child development. Like I'm good
Yeah.
on autism and behavior analysis.
Yeah.
There's not a whole lot new, right? But
Yeah.
supporting young children, developmentally appropriate practice, that's newer to me in the last 13 years because I
Mhm.
moved to NDBI. So those are the
Yeah.
things that I'm going to tend to find. Like, what do I want to level up my skills in
Yeah.
and learn and then take back to what I'm doing? But I love the thought of Asha and something.
Yeah, I mean, another like really, so I agree. I think I would be thinking about like where are those gaps,
Yeah.
right? And having that as a driving factor. The other group that is like very active and I think is a really like potentially good group to get connected with, depending on what you're looking for, is ABCT, which stands for the Association for Behavioral and Cognitive Therapies.
Oh,
They have a very active autism special interest group, and that special interest group, right? It's not specific to NDBI, right? It generally covers. It's historically has been a very mental health focused. Many psychologists are in a mental health oriented group, but it does include folks who are doing NDBI clinical services and research, and it has a really strong emphasis on kind of supporting the mental health of autistic people across their lifespan, and a really strong emphasis on co-production with autistic communities. So I think, like again, there are lots of opportunities to. Sometimes it's a little overwhelming how many opportunities, like, but
yeah.
they have a lot of like free webinars,
Oh my God.
um,
Just
that
send me a
can
link
be
for
good.
them and I'll add
Yeah,
that
of
to
course,
show notes. Or if
of
there's
course.
a group or
Not
however.
NDVI specific, but I think like but I think again, like if you're thinking about just broadening exposure, generally speaking, it's
Yeah.
a really good group.
And that kind of building on that support system that you've talked about, or just listening to different voices or different
Yes,
perspectives. It sounds like a wonderful thing. And if they do things for free, that's also incredible.
I
That's
know.
ability
It's
for
so hard to
people to,
find.
yeah. Or hey, I really liked that topic that I got a
Yeah,
freebie for. I liked it enough. I'm going to go pay for a deeper dive into it. So,
exactly.
right, we're going to build from there. And oh, this is
Yeah,
incredible.
I will
You're
share with you the link. Yeah.
Thank you. You are just a gem of information and resources. I learned something from every one of these incredible podcast
I believe
episodes
it.
we get to do. And I really appreciate your time chatting
Yeah.
with us about your journey, about what you're doing right now, the research, the community access. It's all incredible.
Thanks, Jamie. It's so
Thank
good to
you
be here.
so, so much. It's been amazing.
Yeah, thanks for having me.